This is an exciting story. Technology originally developed for the Canadian Space Agency is now being used to address Canada's astronomical healthcare staffing shortages. This autonomous care unit could soon assess patients in Western Montreal, observing symptoms and vital signs to determine if they need medical attention. Bound Ecosystems, Inc., that's the company behind this technology, is hoping this could go a long way to help Canadians who have no access to family doctors, and we know that number is in the millions. So joining us this morning to explain what this means for our Canadian healthcare system is Andrea Galindo, co-founder and COO of Bound Ecosystems, Inc. Welcome to your morning.
Thank you. Good morning.
This was first developed for astronauts.
That's
Tell us,
correct.
How does the care unit monitor? How does it work?
Well, thank you for having me here. The autonomous care unit was designed, again, as you said, for autonomous healthcare of astronauts in deep space, but also for people in remote communities, meaning they will have a way for them to access primary care on their vital signs, but also doctors will be able to have an assessment on their health regardless of where they are.
And how does this unit determine that? Is it through a blood test? Is it a spit test? How does it work?
No, so we specialize in interoperability of medical devices. Mm-hmm. We collect all that health data and put it in a platform where doctors can have an expert assessment on the factors of the health of the patient.
Am I oversimplifying it by saying it's kind of like ChatGPT, but for a diagnosis?
Yes and no. I don't want to say that because at the end of the day, we want to rely on the doctors on taking the decisions at the end of the day.
Yeah.
The system has been designed to be a decision support system for the healthcare.
And how does this differ from actually going into the doctor? And how accurate would it be between the two?
Well, the pilot that we're doing right now in Montreal, we're starting with patients who do not have a family doctor, so we're helping to alleviate the weight that those patients need to take in order to see a family specialist, a family doctor. So
Sure.
It will be a way for them to go into a place, take vital signs measurements, and all the health data, it's collected and given to a nurse practitioner, a nurse, and then if there is a red flag, for example, they can come in and see a specialist right away.
So if I'm the patient, I'm going in and I have, I'm feeling ill in some way, is it a machine I'm typing this into? Who's taking my vitals and how am I putting that information into the care
Yes, so
unit?
you would stand up in a multivital machine that is capable of measuring a number of vital signs.
Yeah.
And so you just follow the steps. It's going to take you between 5 to 10 minutes, and you're going to be able to see an overview of your entire health yourself as a patient.
Wow.
And the doctor or the nurse practitioner, on the other hand, will be able to see, are there any risk factors that we should take into consideration at the moment or not.
And then forward it to a specialist or whatever needs to be done from there. This is fascinating. According to the research in the Canadian Medical Association Journal, there are 1 in 5 Canadians, just over 6 million adults, who do not have regular access to primary care through a family doctor or a nurse practitioner. So how are you hoping to see this technology used across the country? Where would it be set up? How would it be operated?
Oh my goodness, the opportunities to deploy the technology are endless. We're looking to reach out those small communities in rural areas where accessibility of doctors is not possible, but we see the same problem in cities as well, where a lot of the residents do not have access to a family doctor. So we want to work with organizations to find the best suitable case for each location.
This is a fascinating conversation. Andrea Galindo, thank you for being here this morning.
Thank you so much.
If you liked that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.